Hey guys, and welcome back to Mondays with me, Dr. Crystal. Guess who's back again. We did it. We made it through another week of quarantine. I hope you guys are doing well. I hope you're finding things to do to keep your minds occupied, staying positive. We're headed in the right direction. There is still a long road ahead, but we will get there. We are in this together. So I hope you guys are doing okay through all this. So today I wanted to talk to you guys about something that everyone should be thinking about when they're at a doctor's visit, me included. So of course, when you're seeing your provider, you're gonna have questions about your own specific medical diagnoses. But today, I wanted to talk about kind of generalized questions that you should be asking your doctor. All right, let's get straight to it. 5 things you should be asking your doctor. Number 1, can you explain that again? I love this question because it really means that a patient is trying to understand what's going on with their health. When I'm in a visit with a patient, I do my best to try to explain things in a way that they can understand. Despite my best efforts, there are still times when the patient doesn't understand what I'm saying. It makes total sense that this happens because medicine is complicated. I trained for a bajillion years to learn this stuff, and I'm expecting you to understand what I'm telling you in like a few minutes. It does not bother me at all to explain something again because that means that the patient is going to go home and understand exactly what's going on and what they should be doing, and I can be assured of that and they can be assured of that. So if you don't understand, please ask your provider to explain again. Number 2, so why am I on this medication? So I would hope that when a provider initially starts you on a medication, they would explain why you were going on it. But maybe you zoned out during that part of the visit, or maybe you forgot, or sometimes people just have a list of medications this long and they can't remember what each of them are for. This is another example of taking ownership of your health, knowing which medications you're on and why you're taking them. For the most part, I feel like people don't want to be on medications that they don't need to be on, and so I've had a lot of people ask me, do I actually need this medication? And if I feel like they do, then I have an opportunity to explain to them why and help them understand. If somebody knows why they're taking it and knows why it's important, it makes them more likely to take it regularly and how they're supposed to. If they have no idea why, then it's kind of like, and there have been times where a patient brings a medicine up, tells me they prefer to not be on it, and we decide together that now's the time to try off of it. Number 3, so what should I be doing before the next visit? So this is something that I do try to include when I'm talking to the patient about the plan, but there are times, like if it's a patient I've seen a lot or it's a problem we've been following for a long time, that I might not go into detail about what the patient should be doing. So this question definitely comes into play when we're dealing with chronic conditions like diabetes, high blood pressure, things like that, but also just things like musculoskeletal complaints, like if you're recovering from an injury, what should I be doing? And if you're not clear on that, you should be asking about it. During our 15-minute visit together, we can only do so much. We can talk about stuff, I can teach you some stuff, we might change some medications, but it's the things that are done in between visits that really make the difference most of the time. And so it's important to know what you should be doing. Number 4, would you mind talking to blank? Now this could be your spouse, your children, your parents, whoever might care or be helping you manage your health. So for me, currently working in student health, I talk to parents all the time. These students are transitioning from living at home to being on their own as adults. And so a lot of times their parents are still involved. Probably a majority of the time, the parents are still very involved. When I was in residency and I was seeing older patients, oftentimes they would request that I talk to their children. I seriously have no problem doing it. I'd rather give information directly to someone who is going to be hearing this information than to kind of play a game of telephone. Because if I tell the patient something, the patient then tells their family member, sometimes things get confused, and if this is somebody that is going to be involved in their healthcare, I would rather talk to them if they want me to talk to them. So don't be afraid to ask. Last but not least, number 5. So this one really isn't a specific question, but ask for what you want. So if you're going into a doctor's visit and you expect something to go a certain way and it doesn't, or you expect to be prescribed a certain medication and you aren't, it's always worth asking. If something you're asking for is not indicated or not medically appropriate, then that's my chance to explain why and hopefully help us better understand each other. This most often happens to me with antibiotics. Somebody will come in and say, when this happens to me, I usually get an antibiotic, or I think I need an antibiotic because of this. So oftentimes in this situation, I don't feel they need an antibiotic. And so this is my chance to do some education explain why I don't think they need it, and also explain maybe why it might do more harm than good. I think that asking for what you want during a visit or what you expect is super, super important, because when you go home, you don't want to feel like you left anything on the table or like you finally got to the doctor and you didn't get to say what you wanted to. I think that it's really important for the doctor-patient relationship. That way we can understand each other better. All right, guys, that's it. The 5 things you should be asking your doctor. I hope that was helpful for you. I hope you enjoyed the video. If you did, please don't forget to give it a like, subscribe if you haven't, and I'll see you next time.